screen. Is my screen visible?
Yes, ma'am.
Yes. So in the previous session, we talked about communication in general. Okay, and I specifically mentioned like why is communication so important? Like why are we having these sessions specially dedicated to this particular topic? And that is because of how sensitive this whole area is. That is, we are talking about serious illnesses, and we are talking to people who are really going through a very tough time, who are in a lot of suffering. And so what you say or what you don't say can make a lot of difference. It can change things for better or it can make things worse. So that is why communication becomes very important. Okay, so following up from where we left off last session, okay? This is just a quick recap of what we conveyed in the last session. That is, what can you do in order to communicate effectively? Okay. Now, at any point, if you have any doubts, if you feel like I'm going too fast, or if you are finding it hard to understand what I'm saying, feel free to ask me. Okay. And I can speak English and Malayalam. So if any of you would like me to say something in Malayalam, please let me know. Okay. So in this slide, what you can see, again, topics that we have covered in the last session. That is, when you communicate effectively, apart from the words that you say, how else can you make it more effective? The first one is regarding your body language. Okay, when you're talking to a person, how you're showing interest in them, you're leaning towards them, you're trying to be at their same level, and then talking with an open posture where you're keeping your arms open, maintaining eye contact, all such things. Okay, how you physically present yourself to the person and actively listening to what they're saying. Okay, sometimes when we say communicating, let's say bad news or serious news to them, more than actually speaking, you may have to listen to what they're saying. Maybe they're just crying, they're really crying out or complaining or shouting. Even at all such moments, to be able to listen to what they're expressing. Again, when it comes to active listening, it is not just just being silent over there, but when they're saying something, you're also expressing that concern, you're showing that care. Okay, you're nodding your head or you're shaking your head, or those small gestures that make you understand that the person is listening. Okay, in that sense, you're letting them know that yes, you are understanding what they're saying. Okay, and then another important point that we said is when you're speaking or when you're asking questions, to keep it open ended. Okay, rather than like when I began the session, I said, I hope all of you had your lunch. Okay, so if I'm saying you had your lunch, that is a leading question. So in that sense, rather than asking directly a yes or no answer, keeping it open. Okay, how did you spend time in the afternoon? So they might say if they had lunch, okay, I had lunch and then I slept for some time. Okay, so they'll start sharing a lot of things. No, that is just a simple example. Okay, open ended in the general sense, like how are you feeling? Okay, or are you feeling any pain? But has your pain reduced? All of this then become all of those becomes closed ended. Okay? That is, are you feeling any pain? They can say yes or no. Okay, has your pain reduced? Yes or no again. So we don't want yes or no questions. We'll ask them, how are you feeling now? So they can say anything, whatever that comes to their mind, they can say that honestly. Okay, because the person on the other side, they might not be thinking so much. So when you ask a question, they'll answer just to that question. Okay, they may not even know that I can say more. Okay, like when you say, has your pain reduced? Okay, maybe the patient feels like I'm always complaining about my pain. Again, if I complain about my pain, what will the other person think? So they'll say, yeah, it has reduced. Okay, so see how you're leading them to answer in a particular way. So rather than that, you keep it open-ended. How are you feeling now? So then they'll be able to answer more openly. Yeah. And coming to empathy. So while talking about empathy, I gave this acronym, that is NURSE, especially I understand that there are more number of nurses in this call, so it should be easier for you to remember nurse, where N is for naming, U is for understanding, R is for respect, S for support, and E for exploring. Okay, naming means like uh, you're saying something, they're responding. Let's say they're crying a lot. Okay, they're expressing so much of sadness. So you say that I can see that you're feeling so sad. Okay, or they're in shock with what you said. They're not able to say anything. They're just blank. So you can say that I can see that it must be shocking for you. So you're putting a name, you're labeling it. And when you put a label, it also means that they can correct that. Okay, like you're saying sad. I mean, when you're saying you must be feeling sad, they'll say, no, I'm feeling angry. I'm not feeling sad, I'm feeling angry. That's also okay. You're putting a name just in the beginning so that it might actually help them connect to it or explain themselves more. Okay. And understanding is you show that you understand what they're going through. And you say that I can see how hard it is for you. That is like they'll understand that yes, you are understanding what they are experiencing. So such small statements, or something as simple as saying, I understand what you're going through, or I'm trying to understand what you're going through. All such simple statements would make a lot of difference to them. And respect is whatever they're talking about. Okay, a lot of them, especially when they're struggling with a particular disease, you're actually trying really hard. Okay, so you need to respect every effort that they put in. Okay, rather than it's easy for people to complain and blame, saying that no, you shouldn't be so sad, you shouldn't be so upset, things like that. You should be strong, especially when we talk about cases like cancer. It's very we have this tendency to say that, see, only if you remain strong will you be able to fight the illness. Okay, people say that. I mean, at least common man would say that. So it becomes their responsibility to stay positive and happy so that they can fight the illness. So rather than saying such things, to say that uh, you respect every small effort what they're taking towards this. Okay, every effort they're trying to help them with. Okay, every effort you notice what they're doing, the smallest thing, and you say that you respect them for that. Even if someone says that I believe that God will save me, God will help me. So you can say, I respect your faith. Okay, I respect your faith. You can say, you're not saying it is right or wrong, you're not saying whether God will come or not, but you're saying that I respect your faith. Yeah, in that sense, you can use such statements to actually encourage them and support, because you're working as a team. You're in a better position to say that we are here for you. Let's let's deal with this together. No matter what happens, we are with you. Okay, letting them know that they're not alone. Okay, a lot of times in suffering, people feel like they're all alone. So to remind them that they're not alone, we are with them. Especially in Pallium India, we'll have a lot of patients whose families have left them. They're all alone. In life, they're alone. So to tell them that they're not alone, we are with you. Okay, that makes a lot of that is very important for them. And finally, E for explore. That is when they say something, to ask them questions like, okay, what makes you say that? Okay, my life has lost all meaning. Okay, so rather than saying that, oh, it's so sad that you feel so, or yeah, life can be meaningless sometimes, rather than saying like that, you're asking them, what is making you say so? What is making you feel so? Then they'll explain more, and then you might be able to respond to it in a better manner. So remember this model, this nurse model, because as we go further into uh, talking about bad news and everything, we'll try to respond using this model. Okay, to the questions that they say, especially as nurses and or other health providers. When you're around patients and caregivers, they might express a lot of their worries and sadness. A lot of statements will come up. So how to respond to such a statement? You can use this model. Okay, how can I? Okay, maybe I can say something like, okay, I respect how you have been dealing with the situation, or what makes you feel that way. That is, you're exploring. Okay, and you can say, I understand what you're going through. So using this model would be a good template for you, okay, in order to respond empathetically to even tough questions. So this was a quick recap of what we did in the last session. All these topics were more elaborately discussed in the last session. Today, let's go to the main topic, that is bad news. Okay, what do we mean by bad news? Okay, so as you all can imagine, when you get an information like, okay, you have cancer or a life-threatening situation, okay, then that is bad news, right? That is, this condition has no cure. You'll be permanently bound to your wheelchair. Okay, so such things will feel like bad news to the patient. Yeah, now maybe we come across a lot of such cases as a part of our profession, but the person on the other side, they might be, I mean, they are hearing it for themselves or for their loved one, and probably for the first time. Yeah, so for them, it is a life-changing news. Okay, yeah, it will change their lives forever. So once it this part for you. Yes. Okay, so here, bad news is said as information which drastically and negatively alters a person's view of the future. Okay, like I said, it's life changing, and sadly not life changing for a better way, but negatively. That is, when you talk about an illness, okay, there is no medicine for this. Okay, there is no curable option or curative treatment for this. Okay, you will be permanently in this condition, or maybe you're moving closer to your death. Okay, things like this. So such things become, they're like negatively affecting how you think about your future. Oh, my life is gone, my life is over. Yeah, so just, I mean, you needn't define what bad news is or not. Just for your understanding, what does bad news do to the person? Okay, what does it mean for the person? It changes their life, and that too for in a negative way. They are no longer able to have hope, right? Something that keeps us all going forward is hope, right? That we can do this, or we can achieve that, or we can reach there at this point. Yeah, all that is hope. So with bad news, that hope is just sucked out of your life. So it really changes that person's life drastically. Okay, so here we have a quote by Sheila Cassidy. Okay, it says, the greater the gap between someone's expectations and the reality of the situation, the worse will be the news. Okay, so that is, uh, let's imagine I mean, a young patient, let's say 22, 23-year-old girl, okay, who's aspiring to achieve a lot of things, pursue her higher education or build a career. Okay, she has a lot of hopes for her future, and she comes to know that she has cancer. Okay, and that too, it is spreading across her body. So what happens? Her expectations for life were different. Okay, I'll study more, or I'll have a job. Okay, such things. But the reality is that, okay, maybe she does not have much long to live. So the gap between both of this is so big, so the news becomes worse. But let's say there is this other person who's chronically feeling, I mean, continuously feeling a lot of pain. Okay, and the person realizes that no, something is not right with me. Things are only getting worse for me. Okay, so the person already has this feeling that something is wrong. Okay, so that person is informed that, okay, this is happening, the cancer is spreading. So the person almost knows that, okay, I already knew this. Okay, so the news is, let's say, the amount of shock might be lesser for them. But still, they'll also go through a lot of, denial and everything. Emotional response will be there for them also. But just showing you the person on the other side, things vary, okay? Especially when we, let's say, talk to them about it, the responses become so diverse, so different, depending on where the other person is standing at, what their life situation is, what is their context. All of this makes their response very different. So you need to be aware and mindful that, okay, one person responded this way, that doesn't mean another person will respond the same way. Okay, the responses vary a lot. Okay, so be very sensitive to that. Now, who is the best person to deliver bad news? So over here, we usually have the psychologist along with the doctor maybe, because a lot of times when bad news is shared, they may ask a lot of questions like, okay, what will happen? What is the treatment? What is next? Things like that. For that, maybe the doctor is the right person to answer, give correct answers. So, but to give that kind of an emotional support, maybe the psychologist also is also there, and together they can break the whole bad news. Okay. But having said that, nurses are very often the people who are closely working around the patients and caregivers, and the whole conversation regarding the bad news starts maybe much before. Okay, it's not like a one-time thing, one-time session or anything. The patient or the caregiver may start asking questions like, okay, what is happening? Am I going to die now? Because such questions may come to the nurse. Yeah. So in that sense, anyone who knows the patient well, whom the patient trusts enough to ask such questions, okay, and has a skill, like not to simply say something like everything will be all right. Okay, this is just just normal thing. Okay, not such a person who is aware of, okay, what is the person's condition, okay, and is more than that awareness, is compassionate to the person, okay, what the person is going through. Okay, such a person can deliver the bad news. But yes, it needs to be done in a very orderly manner. You can't simply open up and tell the patient. But if the patient is or the caregiver is asking such questions, you will have to consult with the whole team. Okay, and make sure that you're all on the same page so that what one person says matches to what the other person says. That is, you give out the same message, and also in a very system, because when once you say something, the way they respond can be very intense. So it needs to be planned out properly, and the patient needs to be prepared for that also. Okay. So coming to when is it given? Okay. Now the condition, the information about what the person is having, that is given to the patient only when the patient asks for it, or the caregiver asks for it. Okay. Depending on how their situation is, how it is progressing. Okay, you might put questions like, okay, what do you already know? Okay, what is it that others have told you? And when they show that interest, okay, I want to know. Okay, only when you get that do you actually share it with them. Because if a person says no, I don't want to know about it, no, you don't take it any forward. Okay, you respect what they have said. So that sense, you need to be aware of, okay, when should I say it? Just because you feel like saying it, or just because, okay, this is really important, the person should know what is happening to them. Okay, just because of that, you can't simply say to them. Okay, depending on how the where the patient is, where the caregiver is. Okay, whether they are showing interest, whether they are showing that kind of a interest in knowing what is happening to them or their loved one. Okay, that is when you take it forward. Okay. And usually it is done in a setting. I mean, like I said, a lot of planning goes behind this. It does not happen in one go. Okay, maybe the psychologist, while having sessions with the patient, again the patient is saying, I'm really feeling sick. My condition is getting worse. So the psychologist, or let's say even the doctor, might ask them, okay, how are you feeling? What have you already understood about yourself? That is your understanding where they are right now. And then you would ask, would you like to know more about this? Okay, and then the person might first say, no, I don't want to. The person might deny that. Okay, but again, in the next time you see the patient again, this might happen, and slowly the patient might say, yes, I want it. Okay, it takes time. So once the person is moving towards that direction, you prepare the whole setting so that it can be delivered in a let's say, where other disturbances or distractions may not come. Because like I said earlier, what you're delivering, maybe you have done it several times before, but the person on the other side, that is going to change their life at that moment. Okay, their life is going to change at that moment. So you need to be very sensitive to that, because they will respond in an intense amount of response, emotional response may come. So you need that kind of a setting where it can be contained. Okay, because let's imagine you're saying it in front of a lot of other people, and the person starts crying out loudly, and then the others might come in and they might say something or just keep staring at them. All of that can actually make it more worse. Okay? So the setting where it is done, it needs to be taken care of, and also what you say. Okay, like I said, the whole team, that is doctors, nurses, social workers and psychologists, everyone who's in contact with the patient and caregiver, they all should be aware of what is happening so that no miscommunication happens. Okay? So coming to breaking the bad news, okay, what do you tell them? How much information is given to them? Now, the key rule over here is you give only as much as they want. Okay, some of them I mean, most of them, especially in our settings, they are not high on education. They may not know a lot of things. Even when you say something like cancer, okay, they may not answer what's cancer. Okay, they've heard about it, but then what does it do to you? They don't know. Okay, so you don't want to give them a lecture session of what cancer is and everything, but how it will affect their body. Okay, what can they expect ahead? Things things that they really need to know. And if a person says, I don't want to know any of that, then that is where it ends. You don't put it all on a person unless the person, you make sure what the person wants to know, how much the person wants to know. That is what guides you in taking it forward. Now, uh, naturally, a question will come like, if a person does not want to know, then what do we do? Like, okay, do we not say? But then as the condition gets worse, shouldn't the person know? So what happens is like, you inform the person that, see, there are, when you don't know about this, there are some things that will confuse you. It might be more challenging. Okay. But even when you get to know that, then getting to know that might affect you as well, but it is your choice. Okay. You always keep that door open. That is, when they feel like knowing, they can ask you. You build that kind of trust with them. Okay. You don't push them in any particular direction. You show them that, see, without knowing what your condition is or what is happening to you, you may have a lot of questions. Okay. And that will only make it can make things more challenging for you. So you, if at all, at any point you wish to know, you can come to me, or you can talk, or we can arrange a session with the doctor or whoever. Okay, that is how you take it forward. You show them that you're there along with them. You're not just abandoning them and going. That is when they say, I don't want to know. Okay, fine, all right, I'm going. No, that is not what you do. You stay with them. Okay, you respect their decision and you give them support so that at any point they wish to know more, or they wish to, let inform someone else. Okay, all that, you let them know that all those things are possible. Yeah. All right. So, um, just taking a break over here before we go further. Do any of you have any doubts so far? Okay, just taking a pause so that I'm not rushing into the whole thing, which is also very important while breaking bad news. You don't rush the whole process. It's not about just loading everyone with everything, as in the person informing everything. No, you don't rush. You take it slow. You give a lot of pauses in between. So in a similar way, I'm taking a pause right now. If any of you have any questions, this would be a good time to ask them. Yeah? Any questions? Any doubts? Like
Anybody?
me? Yes. Anyone?
I'm just asking.
Like I said in the last session, when you're communicating with them, the most important thing is you are compassionate. Okay, you don't look at them as a patient, or as, just someone in the setting. Okay, you look at them as if, okay, what would I want if I were in that position? What would I be feeling? Okay, let that be your guiding principle. Okay, because uh, very often there is nothing more to say, because when you're delivering a bad news, it is bad. That is a fact of it. You can't make it sugar coated. You can't make it any easy for them. So the only thing you can do, not, I wouldn't say the only thing, the most important and the most helpful thing that you can do is to show them compassion, and to let them know that you're there as they're feeling hurt and they're feeling so helpless. You're there with them. Okay, that really makes a lot of difference. Okay, even if it's to cry. Okay, when you're with them and you're holding their hand, or just letting them know that I'm here for you. Okay, that really helps them get through the whole thing. Yeah. And
Can
uh,
sorry. Hi.
hi.
Can I just say something about the is how so I've been in palliative care for 4 years now,
Okay.
and the statement you said, I understand what you're going through. I feel that is a very, very it's not it makes patients more agitated because you can never understand what a person is going through
Yeah, yeah.
at any point. It's like telling a mother, a man telling a mother, "Oh, I understand what you have gone through when you have delivered a baby, isn't it?" The men can never understand what
Yeah.
have you gone through. So, in my opinion, saying I understand what you're going through is going to agitate them. It's going to I wouldn't like it when people tell me if I'm going through something and they come and say, "Oh, I understand what you're going through," because you can never understand. You can never
Mm,
when it comes to especially breaking bad news, you can never
mm,
understand what how the other person is feeling. So I think like whatever you said, that is I agree with you 100%. Being with them, just sitting there and just being present is the most important thing. Also, just giving them hints that like not hints, you can actually say it out loud that I'm with you here. If you have any question at all, I'll try
mm,
and help you. But if you need extra support, there can be referrals and stuff like that.
yeah,
So yeah, I think that's the first thing that I realized whenever you say that
yeah,
I
yeah.
understand what you're going through. It's not gonna go down the right way kind of
Yes,
thing. Yeah.
thank you. Thank you for bringing that up.
Yeah. Mm-hmm.
In the last session, I just brushed through it. Like when you say, I understand what you're going through, you need to be sure that you can understand, or else they'll challenge that, whatever you say. And it is a very risky thing to say as well, because now I'm a paraplegic, okay? So below my chest level, my body is paralyzed. So when I speak to a quadriplegic and I suggest in some way that yes, I can understand what the person is struggling with, the person would immediately challenge you. You can move around, you can do this, no, you're able to move your hands and all. Yeah. So again, I'll have to correct myself saying that when you say you understand what a person is going through, it might be just that right then they're crying, and that they have every right to cry. Okay, the pain that they're feeling, that is very real, that there is no need to deny all of that. So yes, what you said is very right. Using that statement can actually agitate a lot of people, because they'll again question, like, you're simply saying that you don't understand what I'm going through. Yeah. So but all what I'm saying is, they need to know that you're understanding them. Okay. And in order for them to know that, active listening is very important. That is, you listen to them, and even when they're crying, as they look up to you, and you're still looking at them, you're maintaining eye contact, and they see that even your eyes are filled with tears. Okay, that is when they'll feel, yes, the other person is feeling my pain. Okay, it's not faking the whole thing. Okay, you need to be very genuine. Okay, the compassion that comes from you, it should be real, and only that is the only way they'll understand that you are understanding them. Okay, but to, let's say, simply to comfort them, you're saying something like everything will be all right. Please don't say that. Okay, everything will be all right. It's a big no. Don't say that. Okay. uh, the same way, I understand what you're going through might be a trigger. Saying that I understand, or I can feel you, I see you, I'm hearing what you're saying, rather than using the word understand, maybe saying such things like, I'm here with you, I see you, I feel you, I can see that you're feeling a lot of pain. Things like that would be really helpful. Yeah. Any more questions or any more suggestions?
Can I say something? I'm Jennifer
Yes.
here. Sorry, I can't on my camera. I do
That's okay.
agree with Vimala saying that I do saying I understand what you're going through, because I personally experience in my experience, I have personally felt that it triggers patient emotion, like they being more frustrated and disappointed at times by us telling that I can understand you. But probably we could rephrase the statement, like as you mentioned in C, that I hear you, I'm here, and correct me if I'm wrong. Yeah, we can rephrase it in way that it must be very tough for you right now to hear this. I can't imagine what you're going through right now. Those statements probably would sound much better.
Yeah.
Like we are telling that I definitely, by telling that I can't imagine what you're going through,
Yeah.
um it must be very tough for you. We know that, we know that we are not understanding them. It's a different, it must be a different situation and emotion for them. So that's my thought
Yes.
about this.
Yeah, very often I found it better to say, I can only imagine what you're going through, rather than saying, I understand. You can say, I can only imagine, or I cannot even imagine. Yeah. Imagine, like imagine in the sense that is what you're doing, right? We're seeing the person, we're trying to imagine what they're going through. So instead of saying understand, yes, imagine. Imagine would be a better substitute. Yeah. Anyone else? Right. So let me just share the screen again. Now we are moving into the whole process, okay? Like how do we actually break the bad news, okay? So the first thing that you do is you check how much the person already knows, okay? Be it a patient or caregiver, what is it that they already know, rather than directly saying that, okay, this is what you have, this is your condition, okay? You first check what the person already knows. Yeah, because that is only way you can understand how can you actually share with them. Okay, because like I said, some people may not understand what cancer is, or you say paraplegia, quadriplegia, you say spinal cord injury, they don't know what it means. Okay? So or let's say they've already heard from some others. Okay, maybe they've consulted other doctors, or they have talked to other inpatients and other people who are in the unit. Okay, and they've already got some ideas and everything. So before checking that, if you start speaking, that will only confuse them even more. Okay, so first you need to understand, okay, how much they know. So you can ask questions like, what have you heard from other doctors, or what has a doctor told you? Okay, what do you already know? Okay, in that sense, you ask questions, or again, keep the questions very open-ended. Okay, don't ask closed-ended questions like, do you know about your condition? Okay, do you know that this is your condition? No, don't ask such questions. You keep it open. What do you know about your what you're going through, or what have you heard from others? Things like that. Okay, so then they'll say what they already know, and depending on that, you can take it forward. So, and also in over here, most of the patients, like I said, they come from backward communities, and so they don't have a lot of medical knowledge. Okay, so you might have to break down the whole thing and say it in simple, clear statements. Okay, that comes later. But assessing their medical knowledge. Okay, when you say terms like, even maybe right now over here it's all Malayalis. Okay, Kerala. So if you use English words, okay, they may not understand. Okay, so in that sense, how far do they know their literacy? Okay, they intelligence, all of this would come into play over here. So hearing from them itself is the first thing that you need to do. Okay, the first thing before you say anything, you ask them what they already know. That is the first thing. Okay, and then now let's say they already responded saying that, I I heard that my situation will get worse, or it will just get bad with time. Okay, let's say that. Okay, and then uh, in order to prepare them for what, like it's like a signal, or you're bringing in a preparation, like saying, okay, what I'm going to say, that is serious news. Okay, you're giving them, it's just one sentence, but it gives them that kind of, okay, something is coming now. Okay, like I said in the last session. Okay, when you say casually, when you say that I've got good news and bad news, which do you want to hear first? What is the purpose of that question? You're informing the other person that there is bad news. Okay, there is bad news, and you're giving them the choice. Okay, do you want the good news first or the bad news first? Okay, so in the same sense, the person on the other side, they might be feeling like they've lost control of their life. Okay, because as a disease is, let's say, overpowering them, they no longer control what is happening to them. So when you put such pauses in between, they feel like a bit more getting that sense of control. Okay, something is coming up. Okay, giving that kind of a pause to prepare. Okay, something is coming, serious news or bad news. Maybe they've already heard something. Okay, so that is true, Because how much ever we hear a bad news, even when you say a bad news, there will be this part in them that will keep believing that, okay, everything will change or something good will happen. I mean, most people, they might think of it that way. Okay, so when you're going to say something, it is like you're going to prove that okay, this is true. There is no way out. Okay, so in that sense, in order to give them that pause to just okay, so that is there. Okay, rather than just directly saying it out loud, in order to prepare them, giving them that warning shot. It's called a warning shot. Okay, that is, I'm going to say something serious. Okay, we have got the results. Okay, the test results have come up. Okay, you inform them that, okay, this is where the conversation is going. Okay, that is the warning shot, which is very important. And once you say that, like I said before, you need to give pauses in between. It's not just, okay, let me finish this, let me get this done with. Okay, please don't rush through it. Okay, because like I said, in the last moment, the person might be saying, no, I'm not ready for this. Okay? Or even if they don't say it out loud, maybe their physical appearance and everything, it'll go all pale, and you realize that the person is not responding to it properly. So you also need time to just take care of them. So take it slowly. Okay, give ample amount of time, because pauses would also give them the chance to say something, ask for something. Okay, and they'll start responding emotionally right from the beginning, because they're already very emotional. Okay, even as you start this conversation, okay, it's highly likely that they're already at the verge of their, they're about to cry, or maybe about to just yell. Depends. Okay, depends. Some people might be, they might look as if they don't feel anything. Okay, I don't feel any emotion. Okay, there are such people also. Okay, but take it slow, give ample amount of time for that. Okay, and then uh, like when we talk about the responses, like I said, it can be varied. People might respond very differently. Some of them might deny feeling anything. No, I don't feel anything. Why should I feel sad? Why should I feel angry? Okay, why should I feel anything? Okay, they'll deny. Or denial can also be like, no, this is not true. Okay, nothing will go wrong with me. I'm such a strong person. In my life, I've overcome everything. So like that, I'll also overcome this. Okay, in that sense, you'll see different sorts of response. Some of them would just break down in front of you. Okay, they'll cry. They'll be shattered. Okay, and they'll start crying out loud, or they'll start yelling, and you'll see all kinds of responses. Some of them might even start laughing. Okay, they'll start laughing hysterically. Okay, depending on the person and whatever is happening with that person. Okay, the person might respond very differently. That is why I say, because one person responded in a way, that does not mean the other person will respond that way. Okay, when one mother might actually be crying for her son or husband, or or the person is crying out so loudly, the other person might actually appear very bold. Okay, will appear very composed, and might not even say something. The person might withdraw. Okay, they'll back off. Okay, in that sense, you'll see different sorts of responses. But whenever you see a response, you should know that, okay, even what you see outside, what is seen outside, behind that there is a lot of underlying, let's say, pain or emotions that are causing all this expression. So when a person might be shouting at you, okay, or they might be complaining and blaming you for something that you didn't even say. Okay, you need to realize that that is just the expression of the pain that is in them. Okay, you need to give them that space. Okay, you cannot react to what they're expressing. You need to understand that it's coming from a lot of pain inside them. Okay, yes. So empathetic statements, these are just examples, like based on how they're responding in. You're just being with them. We have already talked about this. Okay, telling them that yes, I can see how hard this is for you, how this might be shocking. I know this is really bad news. Okay, accepting what it is. Okay, rather than denying that. You see, this happens to a lot of people over here. See, the person on the other bed, he's like that. Please don't make comparisons. Okay, please don't. Okay, people do that, right? when you have like a lot of people have told me, imagine if you were paralyzed below your neck, you wouldn't have been able to move your arms, they would say. Imagine if you had brain injury, you wouldn't have been able to talk or speak this way. Okay. People say that, okay, and that is really foolish. Okay, because the problem for one person, that is their problem. There is no point in comparing with another person and making it lighter or heavier. Okay, that does not help, especially in this scenario. That does not help. We have natural tendencies to say like that because maybe let's say right before this person we already talked to another person and they dealt with it in a better way. Maybe their condition was severe, but they were doing better. Okay, so we might actually say, see, the other person, we had to say this to the other person, but the person was like this. Okay, please don't do that. Okay, you respect the person for who they are and what they are going through is that is entirely theirs. Okay, so in no way have you should you try to make the issue lesser for them. Okay, you needn't try to sugarcoat it because it is bad news. It is bad news. So you just need to accept along with them that yes, it is really hard to hear something like this or live with something like this. You understand them, okay, and you show them that yes, I am here. Okay, I can see what you're going through. Okay, and like I said earlier, the nurse model, naming, understanding, respecting, supporting, and exploring might be a good way to frame your empathetic state. Yeah, and finishing sensitively. Okay, this is towards the end of the conversation, rather than we'll come to this later, okay, because we haven't got to the whole process yet. Okay, so this is like another acronym, okay, spikes, okay. Each of these stages, like now when I say stage, I want you to remember that this is not happening in one go, in one session. No, okay. Like I said earlier, at first the patient may not be willing, okay, but again the next day you talk to the person and the person slowly starts showing a curiosity, okay, what is happening. But then again when you ask, they'd say no, I don't want to know. Okay, or even with the family, okay, when you're with them, okay, they might ask questions, but finally when you say that would you like to know more about this, they might say no, I don't want to. But slowly, maybe they'll end up saying that yes, please tell me, I want to know. Okay, I cannot bear this anymore. Okay, so it takes time, and even while sharing, while breaking the bad news, that is also a very lengthy process. Okay, it's not like you say something and then they'll cry and then you say, I'm here with you, and then you're gone. No, it takes time. They'll take time to respond to you, and for you to be patient with them as they're responding, it'll all take time. Yeah. So the first thing in this model is setting, like I said earlier, making sure that you have the right environment to do this kind of a conversation. Okay, that is, there are no other distractions, no other possible uh, engagements coming in between. Okay, even something like turning off your phone or putting it in silent. Okay, because you don't want to get a call in between. Okay, because it is very sensitive. Yeah. So preparing the right setting, the right environment to have this kind of a conversation. That is a first step. And then coming to P, perception, like we said earlier, checking. Okay, how does the patient or family member perceive the whole situation? Okay, you're checking with them what they already know. How are they looking at the situation? Okay. So in that sense, you're understanding their perception. And then coming to the next step is over here, it's called invitation. Basically, it is asking the person for, uh, would you like to know more about this? Okay, you're asking for their permission and also their preference. Okay, so it is said that now some patients might want their family members to know the situation. They want a family member along with them. Okay, or family members might say that I'm not the one who has been running after this. My brother or the other person has been after this from the beginning. So it might be better if you talk to that person because I don't know anything more about this. Okay. So understanding if you're talking to the right person. Okay. Yeah. So over here at Pallium India, usually the bad news is family members are kept separate and patients separate, because having them all together might make it really chaotic. Okay, because when you start talking to the patient, the family members start crying, or there will be a lot of it will be hard to get through the whole thing. So first, you might talk to the family caregivers, and it is only based on, like, only if they allow do we actually get to talk to the patient. Okay, because they over here, because we are all very family oriented over here, family ties have superiority over here. So based on how the family says, okay, you inform the patient, only then the patient, we go to the patient, but we do it separately. Okay, but asking, like I said before, when you ask them for permission, would you like to know more about this? Okay, would you like to know more about your condition? Or uh, some patients like just a general outline, some patients like more details. So which do you prefer? Do you wish to have someone along with you as you hear this? Okay, such questions, what are you doing when you ask this? They feel like, okay, I can choose something. That little bit of sense of control that they get, that can be empowering for them. Okay, yes, looking at the big picture, the bad news is still there, but as you move towards it, you're preparing them. Okay, all of this comes under preparation. You're preparing them, then, okay, this is something really serious. Okay, maybe I won't be able to handle this all by myself. Maybe I need support, or maybe I don't want to even know this right now. In that sense, you're preparing them, mentally preparing them to hear what is coming next. Okay, so after this, after all of this, that is when the knowledge that is you're sharing with them, you're giving them the information. Okay, that too based on what they are asking for, based on their level. Okay, you don't use technical terms. Okay, like you say, see, they may not understand. You say in simple language, you say, the results show that you have cancer of whichever area it is. You say that. Okay, you give a headline for that, a simple headline. You don't give a descriptive essay answer. Okay, now I have this tendency, especially when it comes to spinal cord injury, and because I used to like anatomy and everything, I tend to explain, like, see, you have the vertebral column behind you, and then there's a spinal cord, and so it has different levels, and whichever level I should explain, I'll give a very big lecture on that. That's for casual conversation. Okay, not regarding breaking bad news, but I'm saying that the people on the other side, this in this situation, they are not in any position to take in a lot of information. Even when they may say that I need to know everything. I need to know everything about my condition. Okay, that does not mean you just overload them with details. Even when they're saying something like that emotionally, uh, it is only a little bit that they can register. So you say the bare minimum, the clearest way to put it forward to them, and then depending on you're keeping it open. Like if they want to know more, definitely they can ask that. Okay, but sharing knowledge according to where they are at, using very basic language, and even the local languages they don't understand, like big terms or anything. You break it down, okay, and deliver it in a way that they understand. Yeah. So that is about the knowledge part, where we're giving them that knowledge, you're giving them that information. And then the emotions, yes, you by this time itself they'll be emotionally responding a lot. So you take note of these emotions. That is what you respond to first. Okay, like when a person is saying that, am I going to die? Am I going to die now? Okay, over there it's not about answering when you're going to die. Okay, usually we have so many. No, it's not about you respond to the emotion. Yes, I can see that the news, it makes you wonder, and that is a very genuine question. Okay, uh, but and then you respond to the emotion first, and then you come to the point that we cannot say how long it will take. Maybe depending on whatever is the condition, whatever is right for you to say, you answer the logical aspect only after responding to the emotion first, because these questions are coming out of emotions. How do I tell my family? What will my wife do once I'm gone? All the financial support is gone. Okay, so immediately you're not saying, okay, see, the wife can probably do this, and then the soul. No, you're not responding to that first. You're responding to emotion first. Yes, these questions are very valid. Yes, and you're caring for your family, and you respond to the emotion first, and only then you get to the logical answer part. Okay, and finally, like when you come to the end of it, that is what we you skipped earlier. That is when you're concluding it, you're summarizing the whole thing. So we discussed about this condition, and these are the steps ahead. Okay, and then you also reassure them that you're with them. You do the support factor. Okay, that we are in this together, no matter what happens. We are here together. And when you say that, you use words like we, ours, okay, us. Okay, it's called partnering language rather than saying you're not saying you, words like you and they. Okay, your children, they will be with you. Okay, you have your family with you. All that might be insignificant for them. So instead of saying you, okay, you use words like we are here to support you. Okay, we have our whole team working for this. We'll make you comfortable. Okay, things like that. We use we word. Okay, so that is the general model. Okay, just taking a break over here. We'll look at each of these elaborately now. Yeah. Any questions so far? Anyone? No question? So two acronyms for you to remember. That is nurse and pikes. Okay, nurse, write it down, okay, if you have to, because it is helpful. Not because very often you don't know how to respond. No? Now, maybe breaking bad news, it is not exactly done by you, as in there will be a team that is like a different approach. But like I said, a lot of such tough questions, they might say things and you really don't know what to say to that. Okay, because we go blank, right? I mean, it's bad news for us also. Okay, so how do you respond to that? So it would be easy for you to remember, okay, can I show some sort of respect to the person? Okay, can I help the person feel better by saying that we are here to support you, we are here together? Or can I help the person by asking them more about how they're feeling? Okay, this is a good model even for your normal conversations. Okay, like when you're just interacting with people, okay, to have more in-depth conversation, it is actually a good model. And once I learned it, I've been trying to use that more. And I noticed that my first response usually it goes to the logical aspect. I try to answer a question. But now I'm saying, no, respond to the emotion first. Okay. They're asking something. Okay, how can you respond to the emotion first? Okay. In that sense, it is helpful. So remember those things. And the spikes thing for the breaking bad news. Now, one thing, the pollution aspect. Okay. Pollution is basically when you're not sharing what the condition is, you're keeping it covered. Okay, because the family says that no, don't say this to the patient, it will only worsen their condition. Let them be at peace. Okay, let them not know this. So that is pollution. When you're keeping it covered, it is pollution. Okay, so you say breaking pollution. Okay, when you're sharing the bad news, when you're discussing it with them, you're breaking the pollution. Okay, just said that because I've not included that in the slide. Okay, so going back to the screen. Okay. Now each of these aspects it's being just explained more elaborately. I've, I've already almost covered it. But setting is basically you're looking at the environment, okay, looking for privacy where there won't be other disturbances, and you can actually listen to what they're saying, okay, and they can also pay attention to what you're saying. Okay, you're setting up the environment in such a way that you can contain it, okay, because there is a big exchange going on. Okay, you are going to exchange a really serious news with them, and in return they'll be giving you a lot of their raw emotions. Yeah, sometimes they might not. Okay, so you're making the space appropriate in order to contain this kind of an exchange. Okay, that is a setting. Coming to perception, like I said, you're checking how they are perceiving. Okay, understanding what they already know about themselves, about the condition. Okay, what is lying ahead, if they know anything about it, okay? Because only then can you actually take it forward. And also how they are feeling, like are they in a position to actually listen to you right now? Okay, all of that comes under perception. Yeah. All right. So questions are also given over here. Okay, how are you feeling right now? Okay, given the situation, what are you thinking about? Okay, these are ways in which you can actually explore. Okay, because they might say that this is not improving. I don't understand what is happening with me. Okay, so then you might be able to say, okay, what have you already heard from others? Have anyone talked to you about this? Okay, so these are like the starter questions. Okay, how are you feeling right now? What are you thinking right now? Things like that. Okay, and what do you know about what you're experiencing? Okay, what have you understood from what you have been told so far? Okay, so such questions, they are just examples for how you can start off the conversation. Check, okay, check with them, okay, where they are, okay, where they're standing right now. All right. So in the red box, you can see that's like a warning. Do not try to address denial if it's your first meeting. Yeah, that is uh, this. Like I said, the breaking bad news. It takes time. Okay, so first when they say I don't want to know, you don't have to debate with them. No, you should know. This is for your good that we are saying this. You should know. You should be aware of what you're going through. Shouldn't you know what you're going through? Please don't do that. Okay. You don't have to. You don't have to push them. Okay. That denial is a phase. Okay. They have every right to deny that because it's so painful. So what we are doing is is supporting them through this whole phase. Okay. We are giving them that kind of a support so that along the way, as they get to the next phase, let's say, even then they feel like, yes, I'm ready right now. Okay, in that sense, so you don't have to push anything or rush in it. All right. And then coming to invitation, that is when you are asking for permission. Okay, permission in the sense like uh, how they would like to know, what they would like to know. Okay, what would you like to know more about? Would you like to know more about this? And do you want to know everything that is going on? Or, like I said earlier, you wish to just know a general outline, or do you want more details? You're giving them the power. Okay, you're handing over the power to them. Yeah, it is what they are going through, right? Their experience, their body is going through, or let's say their mind is going through. Yeah, so you're giving them the power to unwrap and open it as they please. Okay, it's not like you just open and keep it everything over them and let them take it when they want to know. You prepare them. It's all coming under preparation. Okay, so that because it is tough to deal with. Okay, that is why now this whole session on communication is happening because they are in a very, you need to be mindful about this is sensitive space. Okay, and what you say or what you don't say, it can actually change things for it. So you're preparing them in order to receive what is lying ahead of them. Okay. So again, there are some questions over here. Are you someone who likes to know all the details? Now, uh, as opposed to people who might not be so educated, some may be there who likes to check everything on Google. Okay, when they have the slightest doubt, they'll check everything. So they'll read a lot, and so they'll have a lot of ideas. Okay, this is there, and this is happening to me based on what I read here. I've understood this. They already know a lot of things, no? So don't want to make them feel they all that is foolish. Nothing like that. You say that, okay, so you like to know a lot of details. So would you like to know what we have found out, or would you like to know what our clinical opinion is? Okay, in that sense, you're again respecting that. Okay, you have taken so much of effort to read about it. You have shown interest in knowing. You're respecting them. You're respecting their interest and effort. Okay, and then you're asking again, you're giving them the power. Would you like to know what our doctors have to say? Okay, in that sense, again, you're always acknowledging them. Okay, you're prioritizing them. Okay, in all of these conversations. Yeah, and over here in the red box, you can see give a warning shot. Okay, no matter what they already know. Okay, no matter what what they don't know. Okay, before you say something serious, you have to give the warning shot that, see, we have something to share with you, and that is quite serious. It is bad news. Okay, in that sense, you prepare them so that, okay, like I said earlier, they'll have that pause. Okay, pause to just register the whole information. Yeah. Over here, they've given an example also. Things are not improving as we hoped for. Would you like to know more? Okay, so you're giving them an introduction. Okay, things are not improving. That means, okay, things are getting bad. So they can expect what is coming. No, in that sense, you actually give them power when you're inviting them. When you're inviting a person, what does it mean? You're actually giving them the power to accept or reject. Yeah, in that sense, you are giving them power. You're giving them priority. Okay. And coming to the knowledge aspect, that is when you share the information. So when you share the information, make sure you have the right information with you, because you don't want to go wrong over here. You don't want to have to correct yourself later. So whoever is it that is breaking the bad news, you need to be aligned with what the doctors have said, what the diagnosis is, what is the treatment options ahead. All of this, you need to be clear on that. Okay. And when you deliver this information, make sure that it is um, aligned to what they can understand, okay, using basic language and avoiding all those technical terms. Okay, so use patients' primary language. Yes. Okay, that is whatever they understand. Okay, whatever they understand, you give it to them. Like imagine that they are like school children. Okay, so at each grade you have a particular syllabus that is taught to them, because that is what they can comprehend. Yeah, you don't teach a one first standard student what a 12th standard student learns. No, in that sense, respect that. Okay, this is where they are. So only if I communicate in that level would they understand. Okay, and so in that sense, remember when you're sharing knowledge, the information has to be catering to their needs, not for you to feel okay. I've communicated what I should. Okay, no, it is not about you. It is about them. Okay. So again, examples over here. Here is what we need to be prepared for. Here is what we are doing for this condition. Okay, you tell them about what the condition is in a simple, clear statement, and what does it mean? Okay, what does this condition mean? Okay, if I say you the spinal cord injury has made you a paraplegic. Okay, so what does paraplegia mean? It means that you won't be able to move your body or sense according to whatever the situation of the patient is. You say you explain it in a very simple way. And what does that mean? What are the options ahead? Okay, we have physiotherapy ahead. In that sense, you inform them. Okay, that is why it's called the knowledge phase, where you're giving them information. Okay, and coming to the emotions, the only thing you need to remember is respond to the emotions first. Okay, emotions come first. Okay, emotions, because it gets masked. Okay, emotions get easily covered up with logical statements, or aggression becomes a mask for fear. Okay, in that sense, so you respond to that emotion first. Again, we have examples over here. What is going through your mind right now? Okay, what is your biggest concern in the moment? Okay, when they say that my life is over. Okay, when will I die? That question might actually mean maybe they have something to complete. Maybe they have a lot of financial debt to take care of, or they're worried what will happen to their children. There might be other concerns behind this big question. Okay, so you explore more. That is where you use explore. Okay, what are you concerned about? Okay, is there something that you wish to talk about? In that sense, you explore over there. Yeah. And in that sense, you acknowledge their emotions, whatever is it that they're expressing, and what you think might be there. Or if you feel, don't go for assumptions. Okay, if you feel like there is something more to what it is the person is showing, you ask, okay, where is this coming from? What is happening? What is going through your mind right now? Would you like to share something with me? Okay, would you like to talk about this? In that sense, you keep the door open so that they'll know that you're there to listen. Okay, and again, this is a continuation of emotions. Okay, reassuring them, that is, we will do everything we can to help you using partnering language. Okay, we will do our best to take care of you. Again, don't give them false hopes. Okay, everything will be all right. Okay, we'll get out of this. Don't say things like that. Okay, say things that are possible, that are realistic. Okay, that is, we'll help you manage this, or we'll help, we'll make you comfortable. In that sense, we'll try our best. Okay, whatever we can do, we'll be here with you. In that sense, be with them. Okay. The warning over here is be careful not to over compromise or provide a fake reassurance. Yes. Over compromise in the sense, when you say things like everything will be all right, or when you do all of this, you'll feel better, things will get better. Okay, things like that. Because you see them suffering, when you see them so much of pain, you would want to make them feel better. Okay, so you'll say these things, okay, it's okay. I know it is not true, but at least for now they'll feel better. So don't do that, because later on they'll question that. Again, they'll feel like, oh, that it is just worse, and they might not trust you also. So please don't do that. Okay, even if you don't say a lot, just being with them and listening to them, what they have to say, that works. Okay, talk less and listen more. That is what I've learned. Okay. Now coming to the final of that is strategy and summary. That is when you're concluding. Like I said, you summarize. Okay. So what was discussed? Okay, you just summarize. Again, not like the whole thing, but just briefly you summarize, so that they'll also get a chance to look at the whole conversation and, okay, this is what happened. So this is what I have. This is what lies ahead. So this is the person I go to when I have a need. So in that sense, you summarize the whole thing, and always reassuring them that, yes, we are here to support you. Okay. So again, over here we have examples. You told me your concerns were so and so. We discussed this, and the reports indicate this. Okay. In that sense, uh, you ask more questions. What would you like to be able to do that is coming up ahead? Do they have some goals? Would they like to, especially, if they are approaching their death, maybe some of them will start expressing, I really wish to do this. Okay, it might sound very simple, but for them, it is their wish. Okay. So very often when you discuss bad news with them, it actually brings forth the opportunity to get some of their goals and dreams achieved. That is one plus point. Okay, so you need to be able to cater to that also. But yeah, depending on what they are asking for, but to ask them the question that would you like something? Is there something that you really wish to do? Something that we can help you with? Things like that can actually give them a sort of comfort. So yes, that was the whole process. Okay, and like we've already said, a lot of difficult emotions will come up.
Nincy,
Uh,
sorry to interrupt in between. We have a case presentation and we have only 15 minutes more.
yeah.
So, yeah, kindly make it fast.
Okay, so I'll wind up in 15 minutes. Is that okay?
No, no, we have to discuss a patient story after this.
Okay. All
So
right. So we have time till 4:30, right?
4:30, but till 4 o'clock, we'll have a that theory presentation till 4 o'clock. So after that, we have a patient story.
Okay.
So
So now we have the presentation, is it?
yes, yes, yes. Kindly
Okay.
wind up within 5 minutes.
Okay. So just let me just wrap up what I said.
Okay,
Okay.
okay.
Yeah. And then we'll move to the presentation. I'm really sorry it took more time. Yeah. Just a moment. Let me just. Okay. So just these helpful tips for you to remember. Okay. The first thing is you understand, you check for what the patient or caregiver they know. Okay, you check for their understanding. Okay, and then you ask for permission, their preference in order to, before you start sharing something, you ask for that. Okay, you ask for their permission, their preference. And while you're sharing the whole information, use very simple, basic language. Okay, and then once you've shared all of this and they are responding, they start responding, you respond to their emotions first. Keep their emotions first. Okay, it's not about answering their questions. Okay, especially because they'll be asking you very challenging questions. Okay, so respond to the emotion first and use the partnering language where you tell them that we are here with you. Okay, so these are just the helpful tips for you to remember. Okay, so yes, so bad news, it's really hard for us to share and for them to listen. but you prioritize them. Okay, now let's go for the case presentation.
Okay, thank you, Nancy, for the wonderful presentation. So we have a patient story today. Ms. Vimala will be presenting a patient story for us. Vimala, it's over to you.
Hi.
Hello.
All right. I'm going to try and go
Can
through it
you-
really fast. Can you hear me?
Can you
Yes.
able to see the slides?
Yes, I can see the slides.
Yeah. Okay, fine. Go ahead.
Yeah. All right. So my name is Bimla. I'm a nurse from the Garden House Hospice. So this is about a patient. She's 75 and her diagnosis is metastatic breast cancer. She's female. So presenting complaint, uncontrolled pain in abdomen, shortness of breath, fatigue, loss of appetite, confusion, and anxiety. And so history of illness. So this patient complains of loss of appetite, fatigue, and pain in her bones. Was diagnosed in September 22 with metastatic breast cancer. When she was being for her final consultation appointment, her daughter accompanied her, and they were given options of treatment, but the patient wasn't in the correct space of mind, and she's told that she wants her daughter to listen to the options and decide. But she did. The daughter did agree with chemotherapy, which the patient had agreed, and she went for one session, but she was not able to tolerate the side effects. So the doctors advised to withhold further chemo until the patient stabilizes. And then when the patient went home and was seen by the community palliative care nurse, the nurse felt that she would benefit from an inpatient admission because the hospice can manage her symptom and her shortness of breath since they couldn't control it in the home setting. So the patient came into us and the background, she has 3 children, 2 sons and a daughter. On day 4 of her admission, she began deteriorating rapidly. When the patient's daughter realized that the mother was deteriorating, she informed the doctors she does not want the patient to know, and she stated that it would make the mother more anxious and worried. Next. So, but the patient's sons were on the same page, and they said that the daughter cannot make a decision on behalf of the mother because there's no legal paper stating so, and it was just a verbal agreement between the mother with the diagnosis. When the diagnosis was made, the mother did say that she wants the daughter to choose the treatment plan. However, there was nothing stated that she wants her to be the advisor, her health advisor. So when the patient was admitted, it is important when they admit, we do advanced care planning. So the patient was able to make decisions on her own, and the treatment plan was already discussed then. So basic examination, of course, patient was in pain, difficulty in breathing, her saturations were low, but she was with oxygen and some pain medications. And at this point, slide please. At this point, patient was already on a syringe driver with alfentanil. She was still lucid. She appeared to be jaundiced and was on oxygen. So we decided that we need to break the bad news as soon as possible before she loses consciousness or if she deteriorates. So patient was still coherent. During her admission, she already stated to us that the family is what is most important to her. But the patient has also confided in the doctor saying that she actually did not want any treatment and she just wanted to do it for her daughter. She also mentioned that she does not want to be resuscitated. And she agreed that she was a very anxious person who doesn't receive news very well. She had informed the nurses during one of her care that she knows that her time is short, but she's very worried about her daughter as she does not have any other relative and she doesn't have a good relationship with her brothers. Next, please. So the main concern, the doctor was facing an ethical dilemma involving collusion. So the doctor's request to withhold information and the need to break bad news to the patient. The doctor wanted to avoid any immediate distress for the patient, but also knows that it is his duty to respect the patient's autonomy and right to be fully informed about her condition. So the summary is patient was deteriorating, the doctor was not in favor, but finally the doctor was able to explain to the family on the importance of breaking the bad news. So it is important we always have like family conference when there's when they're not agreeing on something. So we could actually break the news, and it's important. It's not only the doctor's job. The nurse should be present because, like it or not, especially in an inpatient unit, we are the one who's seeing the patients the most, and we would have had built that rapport. Sorry. All right. So patient had requested for the family to be with her. So like what Nincy was saying, so the environment is important. So we did tell the patient that we're going to have a discussion about her condition, and she did request for her family to be around. And at this point, the daughter has the information, and when we went in, it was more of trying to gauge on what the patient's level of understanding is on her condition. 9 out of 10 times, most of the patients would know that they are deteriorating because they are the one who's feeling it, they can see it. And in this context, the patient's only reason for not wanting, being anxious about anything is because of the daughter. So next please. So the discussion point here is respecting patient's autonomy, because patient should actually know their condition and should be given the chance to decide on things. But like what Nincy said, I understand there are some patients who say that don't tell me anything, I just don't want to know anything. And we have had patients like that as well. So in that case, we have to respect what the patient's decision is as well, and just keeping them comfortable. So supporting family, as we all know, palliative care is holistic. So, we have to actually be able to give them the confidence that we're not going to just say, oh, we're only seeing the patient and you guys, we don't really care about y'all. But so supporting the families, bringing in family support, social workers, or, having counselor being present if needed. So that is one of the points that can be discussed. Also, balancing ethical principles, like how, it's our duty to actually convey the information. We cannot hide any information. We cannot sugarcoat anything from our point of view. So I think that the way the bad news was broken was very good, because it was in a small chunks of information, waiting and letting everyone absorb it. And also, when we are planning a discussion, we're not going to say, oh, we're going to have a meeting and that's it. We have to actually build it, saying that there will be some difficult news to be shared, so that they are in the proper space of mind to, understand that it's not going to be a very happy news. So they actually come in prepared mentally. And it's also important to be very clear and direct, so that we don't beat around the bush, or the cancer is slowing down. I mean, it's coming faster. We don't beat around the bush. We have to actually be quite direct when it comes to that, because like it or not, when you're very, very emotional, you're going to be absorbing. You're going to only hold on to things that you want to listen to. So then if you're going to sugarcoat it, they're going to be like, oh, so there is hope. I may have time to recover and stuff like that. Yeah.
Thank you, Vimala, for the excellent patient story. So I hope all of you understand well about the patient story. And so once again, congratulate Vimala, ma'am, because you did a good job. Because these patients need to coming to the ethical principles, autonomy. So the patient need a right, because they have a right to know their diagnosis. But in your history of presenting illness, that can you go back to that? So we have to understand that the collusion, always the relatives is here. Here also, the daughter is not willing to disclose the diagnosis to her mother. So that is called collusion, hiding the truth from their loved ones. Why they are hiding the truths from their loved one? That is very, very important. We have to understand their emotions. What they are thinking like is, if they hear this bad news, they will feel more worry. So that thing they will try to avoid. But at the same time, you have to understand that if he or she can understand the diagnosis well, she can do many things for that good period of time. So after that, she will not be able to do anything for their family. So that is very, very important. If someone uh, comes to you and tell you like not So please don't tell the diagnosis to my father or sister or whatever it is, brother or father or something. So what you have to understand is you have to listen their emotions. You have to tell them, okay, we will understand. So I understand your emotions. You don't tell anything, but you at the same time you have to ask them, sit and listen. Why you are trying to that collude, that hiding the truth from your loved ones? Then they will tell many things. Then you have to tell them, like, we are not going to that break the bad news right now, but we have a protocol, like spikes protocol. So step by step we can, if you are willing to that break the bad news, we are going to break the bad news in a step by step. So then you can tell about this, that spikes protocol, right? So before breaking the bad news, you have to understand that uh, their patient's perception, what they are understanding about the diagnosis. And you have a good setup, have a good privacy, need to provide a good privacy. So after that, you have to provide, give a small warning shot. Definitely, if they hear a warning shot, like bad news, definitely they will start express their emotions, maybe cry or shout or something like that. They will be in anxious. So you have to be there to you have enough knowledge, or you have to be there for take care of their emotions. So what we do here is, while we breaking bad news, one doctor, nurse, if possible, one social officer is also sitting together and communicating bad news. But if in between the patients may feel some express their emotions, the nurse go visit the patients and stay there and make them to explore their express their emotions well, no, so they can able to vent out their emotions. And also you have an enough knowledge. A is knowledge. You have an enough, before breaking bad news, you have an enough knowledge to how to break bad news, what you are going to say. And also the final thing is strategy plan. You have to summarize what you are going through, and we are here to some positive things also you can give. Okay, we are here to take care of your problems well. So not that kind of things, you have to give some hope also. Like these kind of symptomatic management. We are here for your symptom management. So that kind of things, you always you have to keep it in mind. Here also you did well. So you, whenever this kind of a collusion there, so definitely you have to try to break the collusion and try to break the bad news. And coming to the ethical principles, you have to respect the patient autonomy and beneficence. Do good for the patients and non-maleficence. So do no harm to the patients. And the last one is justice. So equal distribution of resources. So these four ethical principles also you have to keep it in mind all the time. Okay. So and also you have to, if there is children there, have to think about the rehabilitation. So if they are able to continue their education, if they are willing to continue their education, so you have to find out some sponsors and like educational rehabilitation. Okay, and after death also the bereavement visit is one of the major part. Have to go there, and if possible, you have to go there and visit the patient family. Their psychosocially you understand their emotions, provide psychosocial psychological support. So these all things is very important. If there is any signs and symptoms of depression, how to give a proper treatment for that things also. So otherwise the patients, the relatives may go to suicide. So these kind of things is very important. That is why bereavement visit is very important. If you are not able to go to the patient family, at least to make a phone call and find out how they are feeling. So is there any problem? These kind of things very important. Lindsay, do you want to add anything?
Nothing much. Everything has been covered so far. And always remember that we cannot push in any particular direction because each person, be it the patient or the family member, they are going through their own personal experience. So when we think that, okay, this is the right thing to do, okay, it might not be the right thing for them. And in the case that Vimala shared, the discussion, having all of them together, because sometimes when the family says that no, we should not let the patient know, maybe it comes out of a sort of lack of awareness, or like over here the mother and the daughter, their relationship, the anxiety in that was a major cause. So to be able to address that, okay, to be able to inform them together while respecting them, okay, not to side with them or show partiality to one side, but to inform them that, see, this is what happens when we actually share the news with them. They'll get the chance to do this. Okay, but at the same time, when the person is already having a lot of anxiety, there are also risks for these things. Okay, for them to be informed of that and then giving them the power to choose, making a choice out of complete knowledge and simply having to being forced upon in any particular direction, that's very difficult. So that is very important. And apart from that, throughout the whole process, even after, let's say, the person passes away, providing them support in the form of bereavement support, that is also very crucial. And yeah, together we inform them that they're not alone. That is the whole process about.
Okay, thank you. Anybody wants to add anything?
Can I just add from a nursing point of view? I know breaking bad news mostly it's doctors, but nurses do break bad news too. I also added that it's important for a nurse to be present, yes, to give emotional support, but it's also to actually find out what is the situation like when the news was broken. And like I said, we are the one who's going to be there 24/7, or even if it's house call, we are the one who's going to visit the patient more frequently. So when it happens like that, we will be able to come up with the correct information as well, so that it's not two things. Sometimes the doctor would have said something else and then you go ahead and say something else, so you want to be on the same page all the time. So hence why I said a nurse would benefit. And also some relatives may not be present, and then they would come and then the patient would say, let the nurse explain it to you, and then you can't just go, oh, I don't know. You have to have the proper information, like you said, the knowledge on the current situation of the patient. That's all. Thank you. I know it's 12 o'clock. Yeah.
Thank you. That is true. Always, nurses have to be there because we are spending more time with the patients, and we need to understand the level of knowledge and what was the discussion going on. That all things we should know. So after that, after breaking bad news, also you are going to care this patient. No, so you are there. So you have to understand that what is the level of understanding of the patient and what was happening there and all. So we have to give a emotional support also. If they express their emotions, definitely one nurse should be there for that given psychological support or emotional support, whatever it is. So altogether is a teamwork. So if the teamwork is very important in palliative care. So we all together do many things. Thank you. Okay, we can wind up.
Ma'am, I should thank you first for a good session on communication. I thank you, Miss Vimala Venu, for such a nice case presentation and sending the case presentation on time. That is a thing we should mention firstly. And all participants, you had a very active participation, and thank you. And I thank our facilitator, Ms. Shiva ma'am, also. Thank you.
Thank you.
Thank you everyone.